carry on. So today we're going to look at the process of labor and birth. And in our next lecture, we'll be looking at how yoga can be helpful for this time. So first, we're going to look at birth from a different perspective. So from the yogic point of view, so we can actually look at childbirth as a complete sadhana, a complete yoga practice in itself. It's a very, very spiritual time, a spiritual event. It's a very transformative event. And there's so many things that we can be thinking about at this time, and we can really practice childbirth with yogic awareness. Also, you see, at the time of the birth, the mother is faced with the two extremities. So she has that pain, that strong pain, but she also has pleasure, and she can even have a blissful state. So she's got both sides that she's having to face. And here you can see it ultimately leads her to experience the wonder of creation. And it also has a lot of fulfillment. Childbirth, when it is done, been done in the way that the woman is comfortable with and happy with, it's actually really, really empowering. And she will never forget the time of childbirth. Even if it was traumatic, she won't forget it. But it will have very nice, a positive effect on her if she has a positive birth experience. Now, also from the yogic point of view, one has to surrender, and this can be, a little difficulty for many women during the time of childbirth. But those women who are able to really let go, to really allow that energy to guide them and to follow what is necessary for herself to give birth to her baby, that makes the process so much easier. If we try to hold on to it and try to control the process, that's where there's problems. So that's surrendering and letting go and understanding that we do have a guide inside us. There is that divine energy that is flowing through us, but we need to be able to tap into it. So that is a really important concept when we look at childbirth, particularly from the yogic perspective. And this last point here you can see is a mother goes through the pain to see her child due to love. And just like the great yogis have done for others, a lot of those great yogis in the past, they have gone through a lot of practices, they've gone through a lot of discipline, they've gone through a lot of austerities to be able to bring knowledge and understanding for themselves and to be able to share to others. So continuing looking at birth, so it is a sacred time to experience the power of creation and to bring life into the world. So it's a very, very important event, and it's one that should be respected. It's one that should be treasured. And it is a transition, moving into the next stage of life, motherhood. Of course, I always say that she's a mother from the moment she conceives, but once her baby is out of the womb, again, it's another story. So it's another phase of her life. And definitely a life-changing experience for both the mother and definitely the baby too. Now, looking also, it's a very physical event. You look at a marathon, it's very, very intense. It's a very, very strong physical event. And that's the reason that labor is called what it is as well, because it needs a lot of efforts put in, and it's difficult. So though it's an emotional event as well, it's also a very spiritual event. And we look at a marathon. Now, one can run a marathon and then they can sleep for 10 hours. But the woman who's going through labor, she doesn't have that luxury that she can just go to sleep. She's now got a baby. She's got to breastfeed her baby, look after her baby, do everything to help this human being. So the comparison is there to a marathon because of all of the effects on the body, which can last for a long time. So it is definitely a very powerful spiritual event, changing our direction in life. It's a new journey. It's the journey of motherhood. And it is definitely an event that no woman ever forgets. She might forget the discomfort. She might forget about the pain that she went through, but she will not forget the emotions. Okay, so we'll look at what happens before labor actually begins. So a few weeks before labor, the woman and the baby's pituitary start secreting oxytocin. And this is going to stimulate the contraction of the uterus. Now, there's lots of other hormones involved. It's not only the baby, it's not only the woman, it's a combination of all of these different hormones. You've got the cortisone from the baby's adrenals, there's release of prostaglandins, all sorts of things are interacting and combining together. So it's very hard to understand what exactly is that trigger that starts the labor, and they still don't understand it exactly. But basically, it's the combination of all these things put together which prepares both the woman and baby for the time of labor. And it's a very natural way of having the labor started. There are lots of things that we can do to try to bring the labor on early, but if we allow nature to take its course, then it will naturally prepare both the woman and the baby for that time of labor. So looking at the time of pre-labor, so she will start to have some contractions, and they will be very, very mild to begin with. So just like some menstrual pains, they will intensify in how strong they are. They're going to be felt in the lower belly and sometimes in the lower back, depending on the position of the baby. So those contractions will start to be intensifying. Now here you see Braxton Hicks. Now we've talked about this in trimester 3. She might be feeling those Braxton Hicks as well, and she thinks she's in labor, and it's very common for a woman to go to the hospital saying, I'm in labor now, and for the lady to be sent home again because it's just Braxton Hicks. So that is very, very common, and they can be very strong, those Braxton Hicks. So it's pretty normal for her to think that she's actually in labor. But in real labor, the contractions are going to be more rhythmic. As I said, they're going to start mildly, but then they're going to be building up in intensity. So very rhythmic contractions. It's not going to be like, okay, I have one contraction, then in a couple of hours I have another one. So it'll be much more regular. And when she's starting to have those contractions closer to each other, say every 5 minutes or every 2 minutes, whatever it may be, then she's really starting to get into the real labor. What can also happen is that she might be in that pre-labor period, so her uterus is starting to contract, she's starting to get those contractions, and then it just stops. And that could be just 1 or 2 hours, or it may even be for days. So it's really important that she tries to rest. She does some relaxation as much as possible during this time. So things like yoga nidra is going to be really helpful for her, sleeping, eating well, because when her labor is it really into the full swing of it, then she doesn't know how long it's going to be taking. So pre-labor is the time of rest. Now looking at the first stage of labor, so this is what's officially called labor. So the uterus is contracting at regular intervals, and because the uterus is contracting, basically that uterus is contracting to help dilate the cervix. So the cervix is the opening between the uterus and the vagina, and it needs to dilate to 10 centimeters. If it's not up to 10 centimeters, then she can't move to the second stage. So this is a time of patience. And here it is definitely the longest part of the labor. Here you see generally 4 hours to 24 hours for the first birth is common, and from 2 to 12 for subsequent births. Of course, some women will go through labor much faster, and others will be much longer. Some women give birth within 1 hour from the first pain to the time that their baby is born, and others may be in labor for 3 days. So we never know exactly how the birth is going to be. So that's why it's important to have a lot of rest and relaxation beforehand. Now, there are a few things that can affect how long the labor is going to be. It can be how the mother is feeling. If she's feeling very anxious, very stressed, then that is going to be affecting the length of the labor. It's also going to be affecting the contractions. So if she's feeling very, very stressed, sometimes she's going to be releasing more stress hormones. It's going to be more difficult for her to be dealing with the pain. We'll talk a bit more about that afterwards. Some other feelings that can be there is some unresolved situations. It can even be like feelings that she has with her partner, feelings that she has with her mother, things that have been held inside that she needs to let out. It's interesting that when you read positive birth stories, you'll hear of, women who are laboring for really, really long, the cervix isn't dilating, and all she needed to do was say something to maybe a friend or a mother or a partner, something she needed to express, and once she's got that off her chest, the cervix just dilates. So it's kind of amazing. So yeah, the feelings, the mother's feelings can definitely have an impact. Then how strong the contractions are. If they're very, very strong, then generally the cervix is going to be dilating faster. If the contractions are very weak, then it's going to be taking a longer period of time. And of course, the effect of the contractions, now if she's in a standing position, it's going to be a little stronger generally. If she's laying down, then often the contractions will not be as strong. So she wants to have regular contractions that are going to be increasing in intensity, because every time she has a really strong contraction, that's just bringing her closer to when she gets to meet her baby. Now, there can be other disturbances that are affecting her too. One simple disturbance is just the change of environment. So, for example, she might be at home, she's laboring at home, and then she decides that she wants to go in the hospital. When she gets to the hospital, the contractions stop. This is again very, very common because she doesn't feel as safe there in that environment. It can make her feel scared. Going into a hospital can bring up a lot of different emotions for people. And also because, traditionally birth was not looked at as a medical procedure, whereas it often is these days. So that's where they also encourage a lot of women to spend as much time as she can at home. And then when she started to dilate more, then she comes to the hospital. So, of course, it will vary depending on the woman, if she has any kind of problems, and she'll definitely need to call the hospital or the birth center or wherever she may be and be in communication with her midwife or her doctor. But it is often recommended, especially here in Australia, is recommended to stay at home for as long as you can. Of course, a woman who gives birth in 1 hour, she needs to get to that hospital quick. Otherwise, there's going to be a baby born in the car. And of course, some women choose to birth at home as well. And for the reason of feeling safe and comfortable in her own environment can really make the experience of labor and birth really, really beautiful. So yeah, there's lots of different disturbances that can be there, and we'll talk more about that in the next lecture. Then how prepared her cervix is. So for some women, the cervix is already starting to dilate before she even gets into labor. So it dilates and it thins. And if it is already starting to prepare, if it's already starting to get soft, then that's a really good sign. So another thing we need to think about is, has she gone into labor naturally, or is she having some kind of intervention, like an induction to start off her labor? Because if she needs to have an induction, then her body might not actually be ready. So that's where we also need to get away this idea of the due date, because pretty much there's 40 days, which is normal for baby to be born. So, from a few weeks before to a few weeks afterwards. So it's important as much as possible that she is allowed to go into labor naturally without any kind of artificial thing. Because her body knows what it needs to do. So, for example, when inductions are done, now sometimes inductions are done because they think, oh no, the baby's getting too large, we better just have an induction now. Sometimes it can be that there's other problems that she might be facing. It might be that some of the amniotic fluid is leaking, so they want to induce. But many times they induce just because they want to get the labor and birth over with. So it can be also the perspective of money and time, unfortunately. So having the induction so that, that doctor, he doesn't have to be at the hospital on the weekend. He can go home or he can go on his holiday because he's finished with his due ladies. So unfortunately, that is the way at the moment, but of course, one doesn't always have to accept these ways of induction, and it's always important that one feels supported by their doctor or midwife and they get a second opinion if it's needed. I know for my first, they were encouraging me to have an induction from 37 weeks, and I said there's no way that I'm going to have an induction, and they couldn't do anything about it. And of course she came 8 days late, and that was fine. So also the balance of the hormones, the size and the position of the baby, that is also going to be having an effect on the labor. If baby's in a really good position, so if baby's head is down and in the anterior position, that's much easier way of giving birth or going through labor as well. So that can definitely be helping. Then the size and the shape of the pelvic cavity. Now you hear a lot, especially in Asia, women being told, oh, you don't have a big enough pelvis, so you're going to have a cesarean. Now, it's quite ridiculous really, because you can see very tiny women giving birth to huge babies. So every woman is capable of giving birth to her baby. Of course, sometimes other techniques might be needed, and that's where, yoga practices and different kind of movements come in. If she's laying on the bed, then of course it might be very hard, but definitely the size of the baby. Now, a woman's body is so amazing that it is able to expand so much to be able to give birth to a baby. So this excuse is not really valid. Then making sure that she's having proper fluids and nutrients. This is important because if she's not having enough nutrients, she's going to start feeling really, really tired. And she's not going to be able to deal with the contractions very easily. She's not going to want to be very active. And of course, she'll be dehydrated. So it is important that she's drinking things regularly, whether it's just water or she can put some sugar or salt in. She can have some fruit juice. She can have coconut water. All these things are helpful. She might want to eat something. Some women do. Of course, it depends how long the labor is going on for. And she should be allowed to if she's hungry. It's important that she does, because you also hear stories of, if a woman is in labor, she's not allowed to eat because if she needs to have a cesarean and she's been eating, it's a problem, because she might vomit or whatever. But again, this isn't a very valid excuse, because if someone has an accident and it's an emergency and you need to bring them to hospital and they need to have a procedure, an operation, they need to have an anesthetic, you're not going to say, oh, did you eat beforehand? Oh, no, we can't operate on you. So yes, sometimes she might feel nauseous or vomiting from that, but she can have nausea and vomiting in labor as well. So it's more important that she eats and drinks according to what she needs, because also she can feel very faint if she doesn't. Then, of course, the positions, as I've been mentioning, so upright positions, moving away from the bed is really, really important. And then other kinds of interventions that might be there can also slow the process. If they're wanting to monitor her heart rate all the time, then it can be very difficult for the woman too. She might want to be getting off the bed. She might want to move around, and every time she has to stop so they can monitor it can also be a problem. So in that way, things can slow down a lot. Then if she's having a lot of examinations to check if her cervix has dilated, this can also decrease the contractions because she doesn't feel very comfortable. It's absolutely not a comfortable thing to have when you're in labor or at any time, to be honest. So she can feel very uneasy when this happens. Of course, she also has to be very still when this examination is going on. So this can definitely be a factor in the length of the labor. And it isn't necessary that a woman has to have all these examinations. Many well-trained midwives and well-trained doctors understand what stage of labor she's in. They don't need to touch her. They don't need to do any of this. They understand where she's at according to their observations. So, a lot of these skills are still around, but many doctors or some midwives also are starting to lose those skills, unfortunately. And that's where more and more interventions start to come in. So looking at contractions. So the contractions can be looked at from different perspectives. So there is a practice called hypnobirthing. And hypnobirthing basically calls the contraction an expansion. So instead of tightening, you're expanding, which is kind of good because, yes, you're having that contraction of the uterus, but at the same time, it's allowing the cervix to dilate and open. And that's what we want, and that's what we want to visualize. We don't want to visualize that everything is tightening up, so you're holding everything in. You want to loosen, you want to release. So it's a nice way of thinking. Now, the contractions can be like a really strong menstrual cramp. Everyone feels them differently, so it's very, very subjective. Some women will feel them like really sharp pains. Others will feel them like waves of energy. So again, very different perspectives. Now, one thing is that the contraction, yes, it can be very painful, but it will rise to a peak. So it will get to that peak and then it will disappear. And when that contraction is over, she'll feel amazing. She doesn't have that pain. And she also gets, a surge of lovely hormones, which can make her feel really, really good. Well, not necessarily hormones, but endorphins. So she can feel really, really wonderful after the contraction. So she'll be very, very relaxed. You can say almost to a blissful state, which is really important because if she has that time where she can relax, she can prepare herself for the next contraction. So that's where talking, to herself and saying, yes, I can do this. I got through that contraction. I can get through the next one. It's really, really helpful. So it's really interesting that the body actually has its natural way of helping us to cope with the intense sensations. And yoga can help us to relax even more fully in between the contractions so that we're ready and prepared for the next one. So the first stage of labor has been going on, the contractions are becoming more intense. Now she's getting to that last part of the first stage, and this is known as the transition time. So it's definitely the strongest part. The contractions are very strong, and this is usually the point where she might shout at the doctor or the midwife or the partner. She might say, I can't have this baby. She might start feeling very, very scared and she doesn't want to go through with it, So this is where the emotions can be particularly strong. She can be very impatient as well. It might be that she just wants it all to be over with now, like she's had enough, because she has had to be patient and ride with each of these contractions. She may be having nausea. It's quite common. It's very common that there'll be a surge of adrenaline at this point, so she can actually feel shaky. She might vomit, and she might start to feel that she needs to go to the toilet. And that is an important sign that she's starting to move into that second stage. So she will feel that urge, which she didn't have before. So in the second stage, the cervix is dilated to 10 centimeters. Okay, and this, as I said, it can happen very slowly over a period of time. It might be that it took her a long time to get up to 5 centimeters, and then just 10 minutes and she's already up to 10. You know, it can vary a lot. So the cervix is dilated so that it's a time where baby can start moving down through the cervix and down the pelvic canal and emerge through the vagina. So how long this takes can vary. So for the first birth, usually 1/2 to 2 hours. And for second one, 10 minutes to 1.5 hours. Of course, it can take longer. For some women, up to 2.5 hours. For some, even more than that. And for some, of course, it can just be a couple of minutes as well. So it will vary. It will depend on many factors again. The state of mind, the strength of the pelvic floor. It can also be definitely the positioning that she's in, the environment around her. Lots and lots of things can be affecting the second stage. The one nice thing about the second stage is that it's more active. So she gets to push her baby downwards. So she feels that she's doing something more, whereas the first stage, it's more about just dealing with the contractions and allowing everything to be relaxing. Now she gets to really feel like she's participating more in the birth. So the contractions, of course, are still going to be strong, but when she is having that pushing, many times she won't feel that it's that intense, because she's anyway got the process of pushing. Of course, not all women push in the second stage either. If one is following hypnobirthing, then she may just continue to breathe and try to relax, and then, as they say, breathe my baby out, you know, so giving birth in that way. So this is possible for some women, and they are very happy to do that. For some women, they might try that, but then they feel instinctively that they want to push. And it is really important that she follows her instincts, whether it's breathing out or pushing out. Whatever she feels comfortable with and right with, that's what she should do. And of course, she does need to experiment as well with the different positions and what is going to be working for her. But many women do enjoy the second stage more because they feel that they are more active. During the second stage, so at that time also there can be interventions. Interventions like sometimes they'll say that it's difficult for the baby to crown to come through. They might ask if they can use an intervention, like if they want to do the forceps. Sometimes if they want to get baby out quicker and it's taking a long time with second stage, they may use the forceps. They might use the vacuum. Of course, these have their negative side effects as well, so you do need to be careful. Pretty much with any intervention, you need to be careful. And also sometimes they might do an episiotomy. In different countries, there's different opinions on this. In some countries, many countries, they'll have to ask permission to be able to do any of these procedures on you. There's a lot of controversy with episiotomies. An episiotomy is where they're cutting into the perineum to open the space for the baby to come through. Now, on one side, they say that if we cut, then it's going to prevent tearing. But on the other side, they say that the tearing is more natural and it heals more faster. So, yeah, again, two different opinions. The World Health Organization does not recommend more than 10% of women have episiotomies. And that rate is much higher in many, many countries. So a lot of the time the episiotomy is done, or the forceps or the ventouse, the vacuum is done because they want to get the baby out and finish the procedure so they can get everything ready. They can move the child and the woman into another room, and they freed up a room. Unfortunately, it's often how it is. So they want to do things faster. Whereas if one gives a little bit more time, then often baby will come out without any kind of interventions. Unfortunately, these days they go by the clock a lot, so they want to have all this extra stuff happening. And then the third stage, so she's delivered her baby. The third stage is where she has to deliver her placenta. And this is often not thought about. very much, because it's all about the baby. And yes, of course, the placenta is nowhere near the size of a baby, but it still needs to be birthed. So the placenta is going to separate from the lining of the uterus. How long it takes varies a lot. It can take about 5 minutes or up to an hour naturally. Many times they want to give the injection of Pitocin because they want to get her to birth the placenta fast. And again, that can be because they want, her to finish in that room. Sometimes it can be because they're worried about the amount of blood that she's lost. So then they might use that too. So that's the placenta. Now, another thing to think about is when the baby is born, about cutting the cord. So there's again different opinions on this. When you see it on TV, you often see a baby comes out, immediately they cut the cord. Now they found that if they do what they call delayed cord clamping, so if they wait for at least 5 minutes or until the cord stops pulsing and then cut it, then there's a lot more blood reaching the baby. And it's really, really beneficial. So many places are waiting for that 5 minutes. And of course, there is the other option of not cutting it at all, so a lotus birth. That's not very common, but it is growing in interest. So this is our third stage. It's really important that all of the placenta has been removed, because if a little part of the placenta is remaining inside the womb, then it can create infection. In fact, it can become really, really severe. She can even have sepsis, and it can also create problems of her breastfeeding. So it's really essential that the placenta is completely intact. And then looking at the fourth stage. So this is the first hour after the placenta is delivered, and this is the bonding time. So this is where she's holding her baby, eye to eye, they say, looking into each other's eyes, making sure that baby can touch mother's skin as well is really, really important. And of course, very essential is that first breastfeed of colostrum. So this first feed is where baby's going to get all its nutrients. It's also going to have that comfort, because coming from inside to outside is a really big event for baby, and it's really important that baby can touch mother's skin to feel that connection, to feel the heartbeat, and have that breastfeed. So this is the fourth stage, and there's more and more importance being put on this all over the world now, because they found that if baby is just taken away and looked at by others and doesn't come back to the mother, then she can have a lot of problems of postnatal depression. And it's also essential for that breastfeeding journey to begin as early as possible. So the fourth stage is actually really, really important. And it's also not necessary that a baby needs to be taken away, weighed, wrapped, cleaned, all of this. In fact, the vernix should stay, that covering that's there on the baby. Baby should immediately be given to the mother, and there's no need for the baby to be taken away. Other things can be checked later on. Most important is that baby is with mama.